All right. Hello, everybody. Thank you for joining us today. My name is Sean Curry. I'm the Public Health Planner at the Alexandria Health Department. And I'm joined here today by my colleague, Miss Caitlin Mullins, Community Health Epidemiologist, as well as our friend, Miss Nia Smart, who is the CEO of Smart Public Health Consulting, as well as an Alexandria resident. So we're going to get started here. We're going to talk a little bit about the Community Health Assessment Survey results. All right, so for today's session, a little bit of overview of what we're going to be talking about. So we're going to start off by talking a little bit about the purpose of the survey. Why the heck did we ask all these questions? We're going to talk a little bit about the methods, and then we're going to share the results of what were the big takeaways from everything. After that, we're going to hear about some existing resources already available in our community. And then we're going to wrap up with what's going to happen next in our community health assessment and with the survey results, and then also how you can get involved in everything community health assessment related. Now, first, it's good for us to give an overview of just what is a community health assessment. Now, a community health assessment is a comprehensive review of the state of health in our city. And so what that means is we really want to understand how healthy is Alexandria, where's the good, where's the bad, and where are those pockets of need as well. So that way we can be best informed towards looking at our health programs down the road and making sure that we're doing the best we can to make Alexandria a healthy place for everybody. Within the CHA, we are identifying those community strengths, those shortfalls, and then also opportunities for growth. We're looking at both quantitative, so those numbers, that data side, and then also qualitative. So we want to hear from community members about what's impacting their day-to-day life, because that's just as, if not more important than the quantitative data that we collect. The final product is going to be looking at what are those top health issues in the city. And really, at the end of the day, with the child, we're providing that information to community members so that way they can be informed when they decide on what do we want to do for our next community health improvement plan, which is where we target specific areas or topic areas where we want to improve health in our city. Now, a little bit about the community health assessment and community health improvement plan timeline. So as you see here, I've mapped this out, and I'm just going to speak in broader terms. If you want to access this and dig a little bit deeper, we will be providing these slides afterwards with this presentation recording. As you can see, though, we began this process back in May. And just to orient you here, you will notice there is some overlap between some of these major steps that I've listed here because we are able to work on some of the aspects of a later step while still finishing some of the other items within the current step or the prior step that we're working on. For example, we've completed this community survey back in November, so we were able to begin analysis of it at the beginning of February. And so you're going to be seeing those results today. Well, we're still working on and finishing collecting some of the quantitative data, as well as some other community engagement opportunities. So the main steps going on with our community health assessment and health improvement plan are one, we need to plan and develop the CHA. So what's our approach, the methods, and then who are the stakeholders involved here as well. And then we need to do the data collection piece. So this is all of that quantitative and qualitative data that I was talking about, including these survey results. Once we've done that, we're able to start analyzing and then reviewing the findings and then developing and publishing the final CHA report. We do plan to publish the final CHA report by the end of June, so mark your calendars to learn more about or to see what those final results are going to be and see how you can stay up to date with those things. And then once we've done that, we work from July through the end of 2025 to plan and create and develop the next community health improvement plan, or the CHIP. This development piece will be about 6 months for us to determine what are those three major topic areas for us to focus on within the health department and also within the community over the next 5 years. So what's the purpose of these survey results that we're going to be talking about today? So the survey is going to be providing us with direct input from community members, such as yourselves who are listening today, to better understand what you think are going to be our top health issues, the community strengths, and then also what are those opportunities to improve health in our city. And at the end of the day, we also want to ensure that community members from all backgrounds and demographics have the ability to weigh in and make sure that they are included when it comes to understanding what's impacting our health within the Alexandria city and our day-to-day life. So, enough about what's the purpose of the survey. It's time for us to share a little bit more about the methods and then the results. So I'm going to pass the mic over to Caitlin, our community health epidemiologist.
Thanks, Sean. So what did we do? Between September 3rd and November 1st, we did survey outreach at almost 40 different locations around the city. We also posted about the survey on social media, linked it on the health department website, and emailed subscribers of Alexandria e-News. The survey asked three main questions. What are the biggest health issues in your community? What are your community's greatest strengths? And what would most improve your community's health, along with several different demographic questions. Respondents could choose up to 3 options for each question. So who filled out the survey? We collected 2,020 surveys, mainly on paper. A majority of respondents were women, and almost a third were born outside of the US in countries including Ethiopia, Afghanistan, and El Salvador. Compared to the last CHA, we had a greater proportion of non-English speaking respondents and added Pashto as an option. For single race selections, we well represented the populations of color, even adding African and Middle Eastern North African choices to better capture the racial identity of Alexandria. For this slide and the next few slides, we compare the demographics of CHA survey respondents to the demographics of the entire city using the 2022 American Community Survey 5-year estimates. Most responses were from people who live in Alexandria, with a majority coming from people in zip codes 22304 and 22314, which are our most populated zip codes. We had fairly even representation from each household income category, even though Alexandria's population is skewed more toward the higher incomes. The orange line designates the median household income in Alexandria. Besides the under 18 category, we pretty well followed the age makeup of Alexandria. This graph overlays the American Community Survey age group estimates for the whole city in gray, with the reported age groups of the CHA survey respondents in green. For people 25 years and older, the survey responses were quite representative of the actual population's highest level of education. This graph also overlays the 2022 ACS estimates for highest level of education in gray, with the CHA survey responses in purple. Finally, we asked whether respondents have difficulty with any of the following actions: vision, cognition, mobility, independent living, hearing, and self-care. 415 people said they have difficulty with at least one, with 144 people reporting difficulty with more than one. These are all single count, and people could select more than one, so the total does add up to more than 100%. Now that we know who responded, let's take a look at what they said. These are the top 10 responses overall for the question, what are the biggest health issues in your community? Mental health, substance use, and obesity, physical activity, and nutrition were the top 3 choices. In the following slides, we'll break down how some demographic groups responded to the survey and compare their top 3 choices with the overall survey results. It's important to mention that this question is phrased for people to answer what they think their community's health issues are, not necessarily their personal health issues. This map of Alexandria shows the top 3 health issues identified by residents in each zip code. The highlighted responses are those that are different from the top 3 overall. Notice how many of their responses are similar across zip codes, but each area has unique health issues. Of note, dental problems is listed as a top issue in 22312 and 22311, and violence and crime is a concern in 22302, 22305, and 22314. These are the top 3 responses for race or ethnicity groups, with the total number of people who responded to the question in the bottom row. We removed groups that had less than 20 total responses from this presentation. Middle Eastern North African was one of these groups with 2 few responses. Instead of excluding them, we consulted with community experts to combine demographics like language and country of birth that make up the Middle Eastern North African group you see here. Just like with the zip code map, all groups have at least one response that's the same as the overall, but many community health issues differ. We also looked at top responses by survey language, age group, household income, and education level. A summary of these results are listed here, but a full breakdown for each demographic group, like what we did for race and ethnicity, can be found on our website. Violence and crime is the 4th response overall and is listed by a variety of languages, age groups, incomes, and education levels. Dental problems is a top health issue for community members speaking Spanish, Amharic, and Pashto, households making under 25,000 and between 50 and 100,000, and people with a high school education or less. Chronic health conditions is a priority for people aged 60 to 79 and with a graduate degree or higher. People aged 18 to 29 list tobacco use, and people over 60 list aging-related health concerns. Illnesses spread person to person were concerns for people speaking Dari, Pashto, and Arabic, and illnesses spread by insects were concerns for people speaking Dari and Arabic. This question focuses on things that could be improved about Alexandria that could benefit the community's health. Here are the top 10 responses overall. Improvements to make housing safer, healthier, and more affordable, more support for children, youth, and families, and better access to mental health and substance use services were the top 3 choices. This is how each zip code responded to the question. Besides the top 3 mentioned overall, access to healthcare is something that several zip codes think can be improved. Safe, healthy, and affordable housing was ranked as the top community improvement overall and by each individual racial and ethnic group. Better access to healthcare, job opportunities, and opportunities to be involved in and belong to the community are improvements that multiple racial and ethnic groups feel could improve health. As noted in the past few slides, access to healthcare is something that many people feel can be improved in Alexandria. People speaking Spanish, households making under 50,000, people with less than a high school education, and people under 18 years old listed job opportunities as something that can be improved. People speaking Amharic and Arabic and households making between 100 and 125,000 feel that opportunities to be involved in and belong to the community would improve overall health. Adults aged 60 to 79 want greater support for older adults, and people speaking Dari and Arabic want improvements in public safety. The third question asked on the survey was about what people felt were their community's greatest strengths. The answer choices to this question are very similar to the last about community improvements, but these are more positive focused. The top 3 strengths overall are diversity of the community, opportunities to be involved in and belong to the community, and educational opportunities. People living in 22311, 22305, and 22301 all highly ranked their community as a good place for children, youth, and families to live. Public transportation in 22305 and walkability in 22314 are also strengths. Many racial and ethnic groups had the same top 3 community strengths as the survey respondents overall. Additionally, public transportation was mentioned as a strength by people identifying as Asian, white, and 2 or more races. People of many different backgrounds, ages, incomes, and education levels feel that Alexandria is a good place for children, youth, and families to live. People in their 60s and households making between 100 and 125,000 rank public transportation in their top strengths. Public parks and green spaces are a strength for people speaking Spanish and Dari. Even though safe, healthy, and affordable housing was listed as the top thing to be improved in the community, people speaking Spanish, Pashto, and Arabic still consider it a strength. So that's it for our overview of the CHA survey results. As I mentioned earlier, a more in-depth breakdown of responses by demographics is available on our website. I'll pass it back to Sean now.
All right. Thank you so much, Caitlin, for sharing those results. And like she mentioned, we will have the various tables for all of those demographic groups available on our website for you all to review. So we've shared some of the important community needs, issues, and strengths in our community, as said by our community members. But one thing that's also important is to make sure that we share the resources already available. While these results will inform work in the city, we want to make sure that we communicate about the resources and services already available from the city and from other organizations. Which brings us to our next speaker, Ms. Nia Smart. So Nia is the CEO of Smart Public Health Consulting, as well as a Greater Washington Community Foundation DMV Voices Fellow. As a fellow, her work focuses on 3 main areas: facilitating community engagement, promoting health literacy and education, and amplifying community voices. Today, Nia is going to help share some of those resources and services that listeners can connect with today. Nia, the floor is yours.
Thank you, Sean. Thank you so much for that introduction. So, we all have heard such great results, and I've honestly been following this from the recent community health assessment. And it's clear that there are some opportunities to improve a few things in our city. It's also great to see that we have a dedicated team leading efforts in our city, like the Alexandria Department of Health, the Alexandria Department of Community and Human Services, and other community partners working to understand this data, share it with us, and also develop strategies to tackle these challenges. So, my brain likes to think about solutions and ways I can help those around me. And I wanted to share some information about the resources available right here in our city today. So, let's jump right in. Services are available through the Alexandria Department of Community and Human Services, and the acronym is DCHS. So DCHS provides vital safety net services to improve the quality of life for Alexandrians. So I encourage you to scan the QR code on the slide to follow along with me. Once you get to the website, you can scroll down until you see programs and services, and here are a few of the programs and services available to you. So on the screen, you'll see a list here, and that's what I'm going to go through, okay? So we have DCHS has the Children, Youth, and Family Services program. So this page shares information about childcare provider training, children's mental health services, drug and alcohol prevention and treatment, pregnancy prevention, youth development, college preparation, child abuse and neglect, and foster care. And it has several other resources as well, but I just wanted to give you a brief understanding or synopsis. And on bullet 2, we talk about the page available that will share resources about the benefits for food, healthcare, utilities, and financial assistance. So here you can find information about their customer relations team and how DCHS can help with accessing food and healthcare, including dental, eyeglasses, hearing aids, utilities, financial assistance programs, and more. It's really worth checking out. Did you even know these resources existed? I honestly didn't. And that's why I want to make sure I share these with you today. So, another great resource is the Housing and Homeless Services Program. And with support from partners and organizations, the city provides housing and homeless services, including eviction and foreclosure prevention resources, landlord and tenant mediation services, and information on shelters, affordable homeownership, and rental housing. Also, there are senior housing options, accessibility, and home repair programs. Another program they have is domestic violence, sexual assault, and LGBTQ plus services. It's important to know that DCHS is a safe place to turn to if you or someone you know is experiencing domestic violence or sexual assault. There are programs and services for survivors of rape, sexual harassment, molestation, and other sexual assault, spousal abuse, and other domestic violence. There's also support and resources for LGBTQ plus residents. Another great program available are there's older adult services, and here you will find information about programs and services for older adults and adults with disabilities through the Department of Community and Human Services. Another great program is also the Adult Mental Health, Drug, and Alcohol Treatment and Development Disabilities. That's a long title, but through that, they have in that program services that are available for people experiencing mental health challenges, including anxiety, depression, post-traumatic stress, which is PTSD, and severe mental illness, including psychosis, major depression, bipolar disorder, personality disorders, and schizophrenia. They also have support for individuals with autism, Down syndrome, developmental disabilities, and intellectual disabilities, and also for those with substance use dependencies, including the use of alcohol, opioids, and other drugs, and um, co-occurring disorders. Sorry. And the last bullet here, we have employment and job training. So there's sections for providing information on job seekers and businesses about accessing job training and placement services. I know that was a lot. So now I want you to think, um, would you use these resources? Do you feel that these are helpful? I honestly think they're incredible. So I hope you take the time to review them. And I also encourage you to explore using the QR code to learn a little bit more of the resources on this page. Now, we'll go to slide 2. Let's explore a few more essential resources right here in Alexandria. So I also wanted to let you guys know I have a resource that has been very helpful for me, and it's called the City of Alexandria Community Resources Document for 2025. So this is a great list of services available in Alexandria. It includes information on shelters and homeless services, resources to help you with bills, legal aid, food programs, and so much more. I like to keep a copy saved on my phone just in case someone needs it. And there's also another great document that's called the Alexandria Housing Services and Programs document. This is a valuable resource offering information and support for those seeking housing assistance or facing a housing crisis. It covers various housing services and programs available in Alexandria, from emergency shelter to affordable housing opportunities. Another great resource is ALEX 311. So that's the phone number you can call, and you can dial that on your phone. So if you're not sure where to start with all of the resources I've shared with you today, or if you need help navigating city services, you can just call out ALX 311. The last resource I want to share with you all is findhelp.org. This is an easy to use website that helps you search for local resources. So what happens once you go to the website, you enter your zip code, and then you can include a keyword. For example, you can type in food pantry. Once you select that, you'll then see a list of organizations that can help you in your area. So as you can see, there's a lot of support available in Alexandria, and we don't have to face these challenges alone. Please check out these resources, especially the community resources document. It's like having a roadmap to services right at your fingertips. Don't hesitate to reach out and call ALX 311 if you need help navigating the system. So let's work together in our community to make it healthier, more aware, and fully supported as we all take care of ourselves and our families. Thank you so much. Sean, back to you.
All right. Thank you so much, Nia. And like Nia mentioned, all of these can be found on Alexandria's website. And we will also make sure that we have these links available where you'll be able to find these slideshows on our website as well. So what's next? So got all this information about these survey responses. Just what are we going to do with them? So your responses to this survey are going to be an important piece to help inform the community health assessment. We highlight those top responses overall, and we also importantly look at them from various demographics that were shared today. This is all in an effort to ensure that everyone's voices are included as we evaluate health of our community. For the final report of the CHA, we're going to look at these results as well as the quantitative population level data, and then findings from some additional community input opportunities, other assessments that are going on in the city, either already completed or are going on at this point in time, historical contextual factors, and any other relevant information that's going to best inform our community members about health and the factors impacting health in our community. The final CHA report is going to be used to help create the next Community Health Improvement Plan, or the CHIP, and the results are going to be provided to community members so they have what they need to make an informed decision about what you want us to focus on in the next CHIP. Finally, we also share these results with other agencies and organizations. So your input isn't just going to be used for one assessment. We encourage you to let others know about these results as well so they can understand what Alexandrians are saying about health in our city. So what's next? Well, first and foremost, we want you to stay in touch about all of the CHA activities going on. So we recommend you sign up for our email list. I have a QR code here up at the top right that you can select, where it'll take you right to signing up for the email list. And we hope you do, because that's how you can stay up to date with not just what's going on with the CHA, but also learn about the opportunities to participate. Speaking of which, we do still have opportunities to participate and for you to be able to provide your input into our assessment. Specifically, we're going to be having a community photo album. So this is going to be an opportunity for community members such as yourselves listening today to share what impacts health through photos and other visual ways. And we may even be able to include your photos in our final CHA report. Also, please visit our CHA Alexandria website. That's where you're going to be able to find this recording as well as all the other information and slides that we talked about today. Finally, if you have any follow-up questions or would like to discuss these results further, or would like to access these results in another language other than English, please give us an email at healthmatters@vdh.virginia.gov, and we'd be more than happy to talk with you and learn more about what your questions are and see how we can better serve you. So thank you very much, everyone, for listening to today's presentation. And thank you to both Nia and to Caitlin for presenting with us today. I hope everyone has a great rest of their day.